Hi, how you doing? My name is Jaden. I'm speaking to you about why we believe physician-assisted suicide should be illegal in all 50 states. A couple reasons why are because, one, it violates the doctor's oath as a healer. The doctor's main role is to help heal. He should never be, well, as it said in one of the articles I read, healer, not killer. You should never be a killer and provide you with the means to help you die, but he should always make you feel as comfortable as possible and make you feel, even when you know that you've exhausted all your options and there are no more options, he should still try and make you feel as comfortable as possible, whether that be through a hospice program. Hospice is somewhere where terminally ill patients go. Terminally ill patients are patients who have a sense of 6 months of where to live, and they usually go to these hospice spaces and live out the rest of their months in good practice. And they basically it's like a retirement home, but they're not going to retire. So basically they try and take care of them as much as possible. They provide good housing, shelter. They try and feed them as much as possible, make them as comfortable as possible before they pass away. Another reason we believe that it should be illegal is government insurances. Government and insurance companies can also put pressure on doctors to maybe have physician-assisted suicide have physician-assisted suicide as a main option rather than a secondary option. Because keeping someone alive for a couple months on different types of medication, I think it said it cost $50 billion more than it did to just give someone a pill and they end their life. One last reason that it is unsafe is that it's only, like they said, it's only legal in 5 states right now. So people, say you're in California, so patients in California would have to travel to, I think the closest state is Oregon, to find a doctor to let them participate in physician-assisted suicide. And this can be unsafe because this isn't traveling from California to Oregon. If you lived in California all your life, this isn't your primary caregiver, your primary doctor you've been seeing most of your life. This doctor probably is going to see you maybe once or twice, talk to you once or twice, and doesn't have a real connection on whether you're in your right mind state to make this decision and you really know if that's what you want to do. Because he doesn't really truly know you. He just knows you while you have your terminally ill, whether that be cancer or whatever sickness you may have. Just kind of adding on to what I said. Some patients cannot be in the right mind state when they have terminal illness. According to John Easton, head medical center of public affairs at the University of Chicago, he said terminal illness like cancer, HIV, Ebola, and fever can deteriorate the health of a patient to the point of no return. They also cause a lot of pain to the patient. When these patients' health deteriorates, the capacity to make sound decisions is compromised. Poor health leads to deficiency of minerals that help in thinking condition, which generally reduces the capability of decision making. The mental status of terminally ill patients has lesser capacity to make sound decisions as compared to normal persons. So basically it's saying when someone is diagnosed with a terminally ill disease, sometimes it can affect their mental state and how they think their outlook on the world. For some, it could be a positive and they want to live their life out to the fullest. Others, they can get depressed and feel as if they're a burden to some of their family, or they're bringing extra pressure onto some of their family, so they choose physician-assisted suicide. That kind of leads me into my next topic on family members feeling like a burden, and also family members feeling like a burden, and people becoming less sensitive to the elderly. One thing that all terminal ill patients want more than anything is just a sense of to feel normal. When they're diagnosed, one thing that they feel is, their family members kind of start, treating them a little differently, as necessary, but at the same time, they want the same connections they had before they were diagnosed. They don't want to feel as if they were a sick person. Sorry. According to the Mayo Clinic staff, they said this, that remember that a patient's needs and desires have likely not changed. Many people facing terminal illness want to be treated as normally as possible. Encourage your loved ones to talk about their life. You might be amazed at the stories they have to share. Talking about memories can also help affirm that the person's life mattered and that they will be remembered. One other example of kind of just a way examples of you can make your family member feel needed that I found in research is, as crazy as it is, it's the need to have sex and to still engage in sexual intercourse with your partner when you're married. When you are diagnosed with a terminal illness, often there's this taboo that you don't want to speak about your intimate affairs because you don't know how your partner is feeling. However, they really want to connect with you, and they still want to be able to connect with you, but sometimes it's an awkward state, and they don't know how to speak about it. So having sexual intercourse can also really help make your partner feel wanted and loved. Thank you.
Oh, sorry.